Heart failure is a type of cardiovascular disease, and what it means is that the heart is not pumping efficiently.
Their heart is a little weakened. They have some pumping issues. They will have swelling in their legs. They'll also have weakness and fatigue.
The patient may have trouble breathing, dyspnea, they may have extreme edema, and it's a very scary feeling when you can't breathe. The patients who have heart failure often feel unable to enjoy their activities of daily living. Depending on how severe the heart failure is, they may have trouble walking a great distance. Typically, when you have heart failure, you're living at home and you're okay, and then you start to exacerbate and you may call 911. You end up in an emergency room, you're admitted to a hospital, you may go to subacute rehabilitation, you may get home care. So we spend a tremendous amount of money, and the patient goes through quite a bit of pain going through this cycle, and then when they're home and stable, we remove everything and we wonder why 2 weeks later the patient is hospitalized. Telehealth is the ability to use technology to monitor patients.
It's basically a way to have a virtual doctor's visit with the patient being comfortable at home.
It's a Skype-like mechanism. The clinician can see the patient and the patient can see the clinician. So it's actually, it looks like a small computer with a camera at the top. They press a button and the camera comes on and the nurse is talking to them on the screen.
Hi, Mr. Mann, how are you?
I'm much better since the last time I saw you.
That's good to hear, that's good to hear.
Stacy told me that this was a better way to follow up. It was more closely between the staff and myself. Also, it would be day-to-day tracking of results. She explained the different aspects of the program, what I would be required to do, and how often.
The telehealth sessions are usually once a week, usually last like 15-20 minutes. And we'll go over the vitals that they have taken for the week. If I see any drastic changes in blood pressure or weight changes, I will go over those in details, making sure that they have enough medications and also that they're not having any acute symptoms. I will ask them specific questions such as, you're taking your medications, correct?
Yes, I have.
Okay, good. Any chest pain?
Chest pains, no.
Okay, any dizziness?
When I first sit up or stand up, but it lasts only 10 to 20 seconds.
That's due to your medications and can cause the dizziness if you move too quickly. Those symptoms should go away, and then you'll let me know if it still persists.
I'll keep track of it.
I've been researching telehealth management of heart failure for the past 9 years at the health system. There's a whole team of researchers that are working together to study this. There's a team on the health services research side, there's a team at the National University Medical Center side, and we come together every few weeks to review the data, see how we're doing. We are actually researching to see what kind of things are important to know about using telehealth technology with patients, and with patients from different populations. It's really important to make sure that the technology is appropriate, so that way it is something that is acceptable and usable for patients from different communities. And it's very, very important for us to research what works for what patients at what times. Is it patients that are living in the community, patients who are receiving home care? I mean, who does it help the most? That's what we're doing in our research.
We're trying to see how we can prevent patients from being readmitted to the hospital post-discharge. It's a 3-month study in which we monitor the patient on a weekly basis. They get this machine that takes their vitals, their blood pressure, their pulse, and we also get to listen to their lungs and their heart. Patients are educated on how to use the machine and also how to upload vitals. There is a picture chart that I use here and that they have as well at their house, which have numbers, and I'll tell them to put it on specific numbers. Those are the numbers I use so I can listen better to their lung sounds.
It has all different ways of measuring what's happening with the patient's body. It's as simple as put on the blood pressure cuff and allow the computer to measure your blood pressure so that we know that nothing's happening with you. What's amazing is that the stethoscope, for example, that attaches to the computer that the nurse hears is as clear as you would hear it live. In fact, you can do everything virtually with telehealth.
It's a good way to capture any symptoms that they may have at home or vital signs changes and see how we can interact before the symptoms exacerbate and get worse.
after the patient is discharged from home care and they're independent in the community. Now the standard of care is a doctor's visit every few months. And if you happen to be sick in between that period of time, telehealth monitoring will allow you to pick that up, and you can deal with the exacerbation before it results in an emergency room visit.
There was this one time I had to intervene with the patient and get them in to see the doctor. Right when we was doing our telehealth visit, we was able to give him some medication via IV here in the clinic and send them home a few hours later. Telehealth in that moment prevented a hospitalization.
Our data showing tremendous decreases in ER utilization and a big decrease also as well in hospital admission for these patients.
Some of the benefits I've seen the patients receiving from telehealth is increase in health and major increase in heart function.
One of the greatest advantages outside of the medical aspect is you don't have to struggle your way to the hospital. All that is history. Now you stay in your home and you communicate one-on-one and literally face-to-face. It means I don't have to wait until I feel pain to have them know that something is not right. I would strongly recommend this program. It avoids a lot of unnecessary suffering, and it alerts the medical staff that something needs to be done.
By getting them involved, they're more in tune in what needs to be done in order to feel better, stay out of the hospital, and live longer.
My ideal scenario overall is to be able to make sure that we can best manage the patient at home, make sure that they can stay home and healthy for as long as possible.